Leader of the third party.
Thank you, Honourable Speaker. We often compare our pandemic responses to other countries and other provinces. Indeed, it seems there's a lot to learn, both from the failures and successes of other provinces and countries. Here in Canada, we have the Maritime provinces, which have been very aggressive in their response to COVID-19. With a recent uptick in cases, let's consider the steps they are currently taking. On Monday, with a population of less than 1 million and a total active case count of 323, Nova Scotia processed 11,335 COVID tests and reported 66 positive cases. Rapid tests are available to anyone in Nova Scotia over the age of 16, whether they are exhibiting symptoms or not. All schools in the Halifax Regional Centre and some surrounding communities are closed, and the people of Nova Scotia have been told to stay in their own communities. The positivity rate in Nova Scotia right now is 0.6%. The positivity rate in BC is 9.3%. My questions for you, Honourable Speaker, is to the Minister of Health. Interesting, I'm being heckled on this, Honourable Speaker. It appears from the actions that Nova Scotia is taking, is that it remains committed to keeping COVID-19 cases as close to zero as possible. What is our goal in BC?
Minister of Health.
Thank you, Honourable Speaker, and thanks to the member for her question. Our goal, first of all, is to reduce transmission as much as we can and protect the most vulnerable. And that's been exhibited in our strategy around vaccination, in our strategy since the beginning of the pandemic, one that I think is broadly supported across British Columbia. Our goal is to ensure that our healthcare facilities are not overwhelmed by the real challenges faced with current case counts of COVID-19. Our goal is to ensure that people in communities, people with other healthcare issues, because I remind the member and everyone else that there are approximately 7,900 people in hospital with other conditions than COVID-19, to ensure that people with health and mental health issues get the supports they need. Our goal is to ensure that the impact of the pandemic on those most vulnerable is restrained, and our goal is to make sure that other social conditions, such as keeping schools open, are maintained. We had a discussion with the member's colleague yesterday with respect to rapid testing. Our goal is that on decisions on such as rapid testing, that we are focusing right now on the 2.5 million PCR tests we've done in British Columbia. Our goal is to support public health experts like Dr. Henry as they do their job, and not give them instructions that would divert resources from where they're most needed.
Leader of the third party on supplemental.
Thank you, Honourable Speaker. And the Minister says that at the top, the goal is to reduce transmission. My question really is around the role that he sees testing playing in reducing transmission. Let's compare Nova Scotia's response to our own. For Monday, April 26, British Columbia had a total active case count of 8,199. We processed 8,236 PCR tests, and we reported 763 positive cases. We have more than 5 times the population of Nova Scotia and 20 times the number of active cases, and yet we processed 3,000 fewer case tests over the equivalent period. BC has 2.7 million rapid tests available, but currently only for approved work sites. We have used less than 1% of those tests, and yesterday, when the Minister gave no clarity for when and how those tests will be used, we are coming back and asking again. Jurisdictions that have pursued elimination strategies compared to balanced mitigation have experienced less economic decline, supported higher rates of mobility, and experienced less uncertainty and enjoyed far more flexibility in dealing with the pandemic over time. My question, Honourable Speaker, is to the Minister of Health. Will he commit to rapidly distributing the 2.7 million rapid tests in our stockpile to schools and workplaces? And will he indicate how his government is moving to further implement home-based rapid testing in BC?
Minister of Health.
Thank you. The member will know, and I know she knows this fact, that the home-based rapid testing has not been approved in Canada yet. It has been used in the United Kingdom, and there's a significant debate about the effectiveness of that. In addition, other jurisdictions where politicians have intervened to force more asymptomatic testing, the results have not been positive for those jurisdictions in terms of the application of resources. Our priority is to support British Columbians through this very difficult process, to work with them to reduce transmission in community, to use immunization on our most vulnerable groups, to ensure and to reduce the worst effects of COVID-19, and to work in our hospital system to ensure not just those with COVID, but everyone receives the care they need and deserve. I think this approach is broadly supported in British Columbia. It's led and the advice is given on questions that are important questions of transmission, such as testing, by public health leaders. And I don't think we want to be in a jurisdiction where politicians overturn that, order, instruct, and tell public health experts in issues such as transmission, how and when they should use tests. The member knows we laid out our strategy for rapid testing in detail to her and everyone else in BC on March the 4th. And we're going to continue to follow that strategy, which uses rapid tests, yes, but uses the gold standard PCR test first.